Hi everyone, my name is Brian Jaros and we are coming to you live here from ACR 2025.
Hi, my name is Dr. Elaine Husni. I'm a rheumatologist from the Cleveland Clinic, and Brian and I are going to kick off with From Pain to Wellness in Psoriatic Arthritis.
Yeah, so this was a topic I was really excited to talk about. You'll hear, definitely a lot during this conference about the new therapeutics, biologics that we have in this disease state, which is definitely exciting. But I think this topic explores other questions of how do we, comprehensively or holistically treat these patients with psoriatic arthritis outside of just, the medications that we're giving them. So to kick us off, Elaine's going to tell us about abstract number 2327. This is Persistent Pain in Psoriatic Arthritis, a Distinct Phenotype of Depression, Fatigue, and Catastrophizing.
Yes, thanks, Brian. This is a really interesting work done at NYU. They have a great combined psoriasis, psoriatic arthritis clinic. This is an abstract with Rebecca Haberman, who's talking about pain and psoriatic diseases. So they recruited about 91 patients, and they split them up into 3 groups. So this is commonly the groups that we see, right? Patient with active PsA, a patient that has persistent pain but no swollen joints, and then a control group, or those that are in remission. And interestingly, what they found, they looked at many different patient-reported outcomes. The ones that I thought was interesting was when they were comparing the persistent pain, no swollen joint group versus remission. They found that they did have higher PROs related to catastrophizing pain, higher depression, not necessarily anxiety, higher fatigue, and overall just less quality of life, unfortunately, issues. And so what they found is that was equal, I believe, to the active group, so the group that was having both tender and swollen joints and pain. So I think this really highlights that there are groups that we need to pay maybe closer attention to, right, Brian?
Certainly.
So perhaps even those with persistent pain, we need to really understand their quality of life and their measurements, and maybe we can intervene early and really improve their overall quality of life.
I completely agree, and that is a very perfect segue to talking about, what interventions do we have? What ways can we help these patients recognize them early and exactly improve these quality of life metrics that, of course, to patients, are very meaningful. So now I'll bring us to abstract 0371. This is Lifestyle Coaching in Psoriatic Arthritis, pilot findings from an online coaching program. Elaine will also tell us about this. This is a project she was intimately involved with. So tell us how you came up with this and a little bit about the project.
Thanks so much for highlighting this. I think as we know, our keynote speaker was on wellness, right? And so I think the issue of physician burnout and all these issues are all around us. But what can we do for our patients? And so we have something called eCoaching at the Cleveland Clinic, which, just like it sounds, we go to the patient, right? We don't have to have them come make an appointment for a practitioner. We do this all through email, and these e-coaches are well trained to connect with a patient and to see what they can do with their chronic illness. So we have 4 pillars that we work with. The e-coaches work on mindfulness, they work on exercise, they work on diet, as well as sleep. So in this particular abstract, we enrolled just a little over 80 patients. 86 patients to be exact, and they all had psoriatic diseases, and we looked at their patient-reported outcomes before and after e-coaching.
Sure.
And so e-coaching is really just like it sounds. We connect with them by email at least twice a week is what has shown to be very helpful for the patient. So if you do it less than that, sometimes you don't get as good of a result. And we noticed that they had improvement in their self-efficacy, improvement in their symptom management, and improvement in their medication management. So I think all of this is really good. They can work on whichever pillar they want. So if they have sleep issues, they can focus on that. If they have mindfulness issues, they can work on meditation. Or if they need to do all 4, they can. But we go to them in the e-coaching. So I'm hoping that, maybe in a larger study, maybe in other institutions, that they will pick up on, maybe the use of an e-coach, which is really a low-touch, low-cost alternative to really addressing some of those lifestyle pillars.
Definitely. And I imagine, just thinking about the patients that I treat, a lot of them would be interested in this sort of platform. What was the reception, that you heard from patients about this experience and participating in eCoaching?
Yeah, I think, interestingly, there was a lot of overwhelming, like, yes, I want to do this. And then I think when they got into it and saw that it was a little bit of homework, we felt a little bit of a pause. So I think we do have to set some expectations. This is not like you can sign up and then all of these pillars will get miraculously better. So, but we are able to slowly, step by step, help them through each of the pillars. And I think once they understand that, we did get over 90%, satisfaction. But I think you bring up a really good point. I don't think it is something that is just a one-hit wonder once a week, right? You really need to put in time, be consistent. Our project was over 10 weeks.
I see. Okay. And it sounds like, from your perspective, you think in terms of future directions, larger studies, larger cohorts of patients. Is there anything else you see in kind of the wellness sphere of opportunities for improvement in psoriatic arthritis?
Great question. I think most people inherently want to get better, right? They inherently want to address these lifestyle, but they just don't know how. So I don't think it's a matter of trying to convince people. I don't think anyone's going to say, I want less sleep, right?
Yes.
So I don't think we have to do that, but I think we have to do much better on how to get there.
Awesome. Well, thank you so much for joining me today, Elaine. And that's all we have for today. We'll see you at the next video. Thanks.
And I think Jack has to encourage us to say who's the pain and who's the wellness of our group, right? So we'll let the audience decide.
Take care, everybody.